Hey everyone, welcome back to another episode of Driscoll Decoded. My name is Angela and I am your host. So as you see, we're not in our usual setup today. We are actually in the gym. This is going to be a great episode, very interactive. And I'm so glad to welcome back Dr. Roxana Doucet into the pod. Yeah, so if y'all can remember that first time that she was on Into the Pod, we talked about everything pregnancy, kind of at like a high level of like postpartum and everything that comes with that. And then just like general touches of labor and delivery. Mm-hmm. But today we're going to be talking about in the gym, working out, pregnancy, plus pregnancy. And this, once again, this episode is all for the moms. Bring in your partners, see how they can also help you with this episode and help you beyond as well. But yeah, so strap on in, let's go.
So I'm super happy to be here with you today, Miss Angela, and just to let your audience know, like, how have you been doing? What's been going on?
Yes.
Give us an update.
Yes. So I am 31 weeks pregnant this week. So
awesome.
Almost there.
That's great.
9 weeks to go. Second pregnancy. And I'm just ready. And I feel it. I feel it's so much different compared to my first pregnancy.
Yeah.
And now I'm like feeling all the signs. And now I'm like, oh, is this the time now? Is this the time? But it's definitely... It's much more exciting rather than like the first time and kind of just waiting around like, well, what does this kind of feel like? Mm-hmm. But I kind of like know what to expect now, especially and like with this episode, hitting the gym and how important it is before pregnancy, during, and after. Yeah. But yeah, so I'm ready.
That's awesome. Yeah, I think there's some benefits to being an experienced mom. Mm-hmm. Because now you know things to feel for, the movements, things like that. Yeah. So that's really cool. Well, on the topic of today, what have you been doing for exercise?
So before I was pregnant, I was always like a treadmill girly. Mm-hmm. So I had my moments of when I would like straight run on the treadmill, or I would walk at a fast pace and at an incline. Yeah. So I obviously can't run right now. So what I've been doing is at like a speed of 2.5 and an incline of 6.
Hey, that's
for like
good.
30 minutes.
Wow.
Yeah.
Okay.
And I really feel it afterwards. And then that's what I kind of just like let my body just do what it needs to do. Yeah. And then afterwards I'll do like just like toning on my arms, just kind of keeping something toned.
Yeah. Perfect.
And then I'm a big legs person.
Okay.
Yeah, because if anything, that's what's for me the easiest to keep toned. Yeah. So I'm doing squats with like dumbbells, but definitely listening to my body.
Yes.
And knowing when to take a rest and even just to call it a day. Yeah. So that's what I'm doing right now.
Yeah, I think in terms of exercise in general in pregnancy, I think the best thing you can do is try to exercise before the pregnancy starts.
Agreed.
So the fact that you were an exerciser and a treadmill girly was awesome. But it doesn't mean that once you're pregnant, you can't start exercising. And we know there's a lot of benefits to exercising in pregnancy. And we'll get into that in just a minute. But if people can exercise before they get pregnant, then they're more conditioned to handle all the stresses and all the physiologic changes that occur with pregnancy, like the breathing and the circulation and the fluid volume shifts and all those things. So I think that's great.
I do feel a difference, like whenever, especially after a workout, I feel more like able to go throughout the day. Like nothing is so heavy compared to like whenever I wasn't working out during pregnancy. Even if it was just like first trimester, second, I really felt like the heaviness of pregnancy. Yeah. So I completely agree with you. Like with getting your body ready for whenever that time may come, makes it just so much easier. During pregnancy.
Well, and I think that's just part of general health. I mean, we always talk about, balancing your diet and drinking lots of liquids and exercising every day, taking vitamins with folic acid, because you never know when that conception and the pregnancy is going to happen. So if you're being proactive with your health, and when you do get pregnant and you enter into the pregnancy, you're ready to go.
Agreed.
So, yeah.
And also, like, because I want to go into a VBAC.
Oh, yes.
So I feel like, I mean, correct me if I'm wrong, but I feel like going to the gym and being conditioned for that helps whenever that time comes.
That's
like,
right.
just getting my heart ready, getting my heart used to kind of that, like, that fast paced,
Yep.
and like just getting from like walking to like doing squats, like getting my body literally ready to hopefully have a successful VBAC.
That's really great. So research has been done that women who exercise in their pregnancy have a higher chance of having a vaginal birth, whether that be a VBAC or a vaginal birth after cesarean or just natural vaginal delivery if you've experienced that before.
Okay.
That goes up. Also, the other benefits include like decreasing the risk of gestational diabetes, gestational hypertension or complications. It helps you maintain your weight. And so, we know that women who gain too much weight in their pregnancy, they're at higher risk of having a cesarean section. So maintaining weight, it also can control some of the weight of the baby, believe it or not.
Really?
Yeah, research has shown that if women exercise, it doesn't increase the risk of growth restriction, what we call small for gestational age or intrauterine growth restriction, unless there's other medical conditions. But those babies are about on average 200 grams smaller. So if you're really trying to VBAC and you want to have a better chance with a more fittable size baby, exercising is good. But there are some things that people should know that I want the audience to know is definitely need to go to your OB and talk about exercise before, because there are some medical conditions that would warrant maybe not exercising so much or maybe not exercising at all.
Okay.
So that's important to have clearance from the medical doctor. And then to set your goals, like, what are the goals for the pregnancies? There are some pluses and minuses of different exercises in pregnancy that are acceptable. So we can get into that in a little bit. But number one take home is talk to your OB provider. Make sure that you are a good candidate for exercise. And I think you said the right thing by listening to your body. What feels good, what doesn't feel good. That's important also. And then for women who aren't exercisers, I think pregnancy is a good instigator of change, right? So we talk about eating healthy and drinking more water and stop smoking and no more drinking and no more drugs. But it's an instigator of change. So getting exercise incorporated into your daily routine is important. So, but starting off with little goals, like short-term goals, like, okay, I'm going to exercise 5 minutes today. And then maybe next week, I'm going to increase that to 8 or 10 minutes. And then maybe the week after that, it's going to go up to 15, 20 minutes. And the goal would be that women should exercise about 20 to 30 minutes, 5 to 7 times per week. That is considered appropriate exercise in pregnancy. And so we'll go into different exercises in a little bit.
Okay, perfect.
So I was going to say something like we're sitting on these balls. There are squatting balls that they use in the labor unit. So this is a tool that's commonly used. And we were just teasing because I almost fell off my ball. It works on core. And the reason why working on core is important when you're pregnant is, the pregnancy is growing, the baby is growing and stretching the rectus muscles, the stomach muscles. Your center of equilibrium gets off, but a lot of people suffer from back pain while they're pregnant. And about 60 to 70% of women have back pain in pregnancy. So it's very common. But if you work on core, like sitting on these balls and kind of engaging the core muscles, that will help strengthen the muscles in the front and help support the muscles in the back. So it will help strengthen all the way around so that the back pain isn't so bad.
Agreed. And there's so many, you don't have to go to the gym to get a workout. There's, which I'm learning too, there's so many YouTube videos geared to like even like pregnancy. Of course, like do your research before like you jump on any like pregnancy videos, workouts, making sure it's like backed up by the appropriate professionals. But there's like just like either just like a light cardio at home. And just everything is accessible, and even just like going outside for a walk. Is lost my train of thought.
It's called placental shunt syndrome. Not really. That's where all the blood's going to the baby.
I said, what was I saying?
That's so funny.
Love it. Pregnancy brain.
Pregnancy brain. But I think that opens a good topic of discussion, like what exercises are considered appropriate in pregnancy and things to do and not to do. So let's talk about that a little bit. You mentioned going for a walk, and that's perfect. I think that that's a good, appropriate first step. I think that women who go into their pregnancy that are already exercisers, they should continue what they're doing.
Okay.
Like there's been research done on Olympic athletes and elite athletes, and I'm not going to get into that because that's not our audience and our goal today. But doing whatever exercise you're doing is good. So if you're a walker, keep doing. If you're a treadmill girly, keep doing. If you're a bicycler, stationary bike, anything that gets cardiovascular benefit, and get your heart rate up, that's very good.
Okay.
You also mentioned at the beginning that lifting weights and engaging your legs. So these are big muscles. So that will help you maintain your weight because you're building those big muscles of your body. But the goal would be doing cardiovascular, 20, 30 minutes.
Okay.
But also doing some sort of weightlifting to maintain the tone.
Yeah.
And especially mommies out there that are experienced and mommies who are not experienced, you're carrying a baby all the time.
Yes.
So you need to make sure your biceps and triceps are good and your upper back because you're going to be carrying babies a lot. And so keeping those muscles conditioned is good.
That's funny because that's, I was literally telling my husband this the other day, like that's my motivation. Cause I was never really like an arm person. But after having like my first daughter, if our audience remembers, she was 9'11". And so I'm like, I don't know what, like, I'm hoping this baby be like in the 7, maybe 8 pound range. But like, I need to prepare like either way, like having that like
and
motivation.
You may be doing
right
one of these and one of these. You know, you may have a baby on each
side.
Exactly. So, you know, you got to work
on both of them.
So, but doing those kind of exercises are important. The other thing that I like, especially in South Texas, is we're so hot. So it's very, very important that women stay hydrated and they stay cool.
Okay.
So it may require them to literally go to a gym where there's air conditioning so they can not increase their core body temperature too high, staying hydrated. But I also like pool exercises. So because, you know, you're having the center of equilibrium getting shifted with the baby in the front. And so, and your back is hurting, but when you get in water, you're more buoyant.
Gotcha.
So getting in there and swimming or standing in place and jogging, I mean, all those activities in water, plus it's summertime, so you're staying cool. But if you're going to do something outside, I would encourage women to maybe go in the evening when the sun goes down or maybe first in the morning before the sun comes up because it's just too hot. And we don't want our moms to overheat.
Exactly. And I did have a question for you because when I'm working out and, you know, I'm sweating and like I feel hot, like is there like a certain point, of course, like listening to my body, but like is there a certain point that makes sure like I'm not overheating even in the gym?
Yeah, I mean, it's going to be hard to overheat in the gym, sort of like where we are now. And it's very comfortable and the temperature is nice. So that would be very hard to do. But if you go outside, that's a problem.
Gotcha.
The problem with checking your core body temperature is you would have to be exercising with the thermometer in your mouth or like one of those ear temperature things on the forehead. That's just impractical. I would say the biggest guide is that I call it the talk test. And like, this is a real thing. If you're walking or exercising and you can't carry on a conversation, as a pregnant mommy, you may be overexerting yourself. So you need to slow it down. So if you're on your treadmill and you're like, hang on, I can't catch my breath, you know, you need to slow it down a little bit. That might be too much. So doing the talk test or working out with a buddy and having a conversation, you know, if you're really getting short of breath, maybe you should slow it down.
I did not know that. That's a great tip right there.
There's calculations and formulas to figure out where you should be for your height and your weight. And all those kind of things when you're pregnant. But the simple talk test is the best way to go.
Oh, I love that. That's a great tip to give.
And it would be a good idea maybe if you get a support group and you go for a walk, or if you're making changes in your diet with your family, you can invite maybe your sister to go walk with you, or your partner or your mom, or, you know, fighting diabetes in South Texas and hypertension is important, keeping your weight down. So just invite a buddy to exercise with you. That's really important.
Yes, and it's so much easier with like a support system, whether that's like friends or like a group that you make. Like it's so much easier because everyone's like held accountable.
Yeah, for sure.
So speaking of like, you know, lifestyle changes and everything like that, being healthy during pregnancy, you know, whether we were healthy before or could have been healthier before, there's all these kind of like stigmas that come with pregnancy, such as like the eating for two.
Right.
Or other types as well. So like, what's your intake whenever like you see patients and, you know, first time moms or even like second time moms really too, like, well, I was fine like my first pregnancy, like I can eat this, or and with everything being different, like, what are your thoughts about like how we need to put an end to like that stigma?
Yeah, it's sort of like I alluded to before. Pregnancy is an instigator change, right, for healthier behaviors. And so I disagree with the statement of eating for two. As we know, in South Texas, we deal with a lot of gestational diabetes. That means diabetes or elevated sugars while you're pregnant. Or some people come into their pregnancy already with diabetes, and they have to be very careful with what they eat and how their sugars are fluctuating.
Yeah.
So you're not really eating for two. You need to eat healthy for yourself. Staying hydrated, incorporating good fruits and vegetables. In pregnancy, women always get constipated. So hydrating and getting lots of natural fibers in. All these things are important. It's easy when you're pregnant. You're like, okay, now I got the excuse. I can have that extra slice of pizza.
I'm just like more hungry.
Or maybe just more hungry. But cheating with diet is because you're using the pregnancy as the excuse. And unfortunately, there are many patients who will gain 50, 60, 70 pounds, and that is so not healthy. For every weight going into the pregnancy, there's a recommended amount of pounds they should gain. And a lot of the weight is gained in the third trimester when we're expanding our fluid volume, we're retaining fluid, we're starting to get swollen, our placenta grows, the uterus actually grows, our blood volume expands, the baby's growing.
Yeah.
So it's not just body fat or mommy that's gaining the weight. There's other things that attribute to the weight gain in the third trimester. So being very mindful about what we're eating and watching our calorie intake is important, so you have appropriate weight gain in your pregnancy. And talking to your OB provider will help guide you to see if you're on track. Every time you go to your appointment, which is so important that you get prenatal care and you go to your appointments, they're checking your urine for infection and for protein and problems. They're checking your weight every time you come in because they're tracking that. Blood pressure, vital signs. There's reasons why we do all those things because we're looking for the problems before they occur. And weight gain is one of those things.
Gotcha.
Yeah, we know that women who gain too much weight, I may have already mentioned this, they're at higher risk for a C-section. Yeah. So it's very careful to exercise and monitor their weight gain.
Yes, like, which makes sense. Like, back to my first pregnancy, I'm gonna be very open here. So right now I'm in my third trimester, so 31 weeks, and I'm about to hit that mark of like, okay, like this is. That was that mark when we first when I first went into the OB for this pregnancy. She's like, okay, this is how much I want you to gain. Yeah, this is the max.
So y'all went through that, which is great.
Yes, yeah. And so like now I'm starting to see that number. I'm like, stop. Like,
yes,
I don't want to go. Like, I don't want to go anymore. I don't want to check my weight. Of course, I'm still gonna go. Yeah, but like it's
turn around. Yeah, stand on the scale backwards.
Let me take off my shoes real quick. But yeah, so what, I'm already creeping up on that number. Yeah. And I'm working out, like I'm trying to, also what's kind of easier, I don't know if this is totally off topic, but like what's easier is like in the third trimester, not having 3 big meals and eating less but more frequently. It's kind of easier to like manage of like what's going into my body. But oh man, I'm just like ready, like, okay, like I seen this and I'm like, oh man, like I'm looking forward to like that clearance of afterwards of like working out, because I just don't want to go back to the way it was my first pregnancy. Yeah. I don't know. There's so many thoughts that go on, through my brain.
Well, so, and maybe you don't want to talk about this in front of your audience, but what was the range of weight that you gained the first time?
Oh, you're about to know my whole life.
You don't have to say.
For my audience, I'm gonna be so truthful. I gained about 30 to 40 pounds.
Okay.
And we're looking back at it, like we had no idea. We had a great OB, okay? We had a great OB, but we weren't educated enough on the do's and don'ts.
Yeah.
Also, we were living away from family, and of course, like, you know, there's like stuff that we should like take upon ourselves. But we were so excited too.
Yeah.
So like it was a lot of like first time things, and it's funny because like my husband, like he gained the weight with me, and how they say that partners can go through that as well.
Yes. It's very common.
Before, so when getting pregnant for the second time, we were both like, okay, no, like,
careful.
Yes. So yeah, so it's just like, I don't want to slip back into that kind of how I felt afterwards too. Because that alluded to postpartum depression and everything like that.
Well, and so that's very important that you bring that up, because I remember patients when I was in private practice that they would gain, and I would watch them. I'm like, you need to really slow down or be careful, maybe start walking, doing some sort of exercise, watch your calories. And then we would deal with their postpartum depression, like, look at my body, look what happened. And now I got to get it all back. And so I would always tell them, if you're careful with your weight gain throughout the pregnancy, you're going to lose 10, 15 pounds so fast at the beginning, because it's the fluid, it's the baby, it's the placenta, and you're going to feel like triumphant. But what if you gain too much and then you've got another 30, 40 to lose? Then it's almost daunting. Like, oh my gosh, how am I going to get all this weight off? But if you're very careful with the weight gain, which should happen in pregnancy, appropriate amount, and your OB will monitor that, then it's less of an obstacle to face postpartum. And then you're less likely to get postpartum depression. And also, women who exercise, this has also been studied, women who exercise postpartum have less chance of postpartum depression as well. Everybody gets a little bit of the blues, but the actual depression is less in women who exercise. That's proven as well.
I see that. So is it true that like when you're exercising, if anything, like a mom who wants to start exercising during her pregnancy and she's doing like, she's got her workout routine going. Is it true that like once we have the baby, like our body remembers like how it's supposed to be, or like, so it just like, it's easier to kind of like.
I think it's easier. Yeah. I hear what you're alluding to. I think it's easier to get yourself back into your pre-pregnancy state if you've been exercising throughout the pregnancy. Like your body's already sort of conditioned. And so you handle your delivery better, you recover better, and then you bounce back faster because you've been exercising. It's not like, okay, I didn't exercise while I was pregnant and I gained 30 pounds, 40 pounds, 50 pounds. Now I need to lose it. Now I'm going to exercise. And then you're sleep deprived, and hopefully you're breastfeeding, and you're exhausted taking care of your family, especially if you have more than one or two children. I mean, there's just so many things. I don't have time to exercise. I don't have time to. When am I going to exercise? I can't. So if you're doing it and incorporating into your life pre-pregnancy while you're pregnant, then it's easier to incorporate postpartum, and it's just part of your lifestyle routine, for sure.
I'm excited to see like how I'm going to feel afterwards, and then we can like do a catch up afterwards to see how.
Well, let's go into a little bit about things not to do while you're pregnant. When we left off, we were talking a little bit about the types of exercises and things. I just want to mention some definite don'ts while you're pregnant.
Yes, please.
And especially after about the 18 to 20 week mark, whatever exercises women are doing while they're pregnant, they shouldn't lay flat on their back anymore.
Okay.
It has to do with circulation in the body and getting good flow to the placenta, to the baby, and to the mommy. So laying flat on the back will put the uterus on the big blood vessels of the body. It will inhibit some of that flow. So it's very important that pregnant moms don't lay flat on their back. That's why whenever you go to the hospital, and for women out there who've experienced a C-section, we always are tilting the hips. We're always wedging the hips, tilting to a side. And it has to do with circulation and flow. So if you're doing leg work on the floor, just lay on your side. Or if you want to sit down and relax, or lay down and relax and do some arm work on the floor, just lay on your side. So it's super important with those kind of don'ts. And then we've already talked about talking when you're exercising. If you feel like you're super short of breath, you need to slow it down. That's a big no-no. And of course, check with your OB, make sure that you're a good candidate to be exercising.
Agreed.
And then a little bit that I wanted to mention before we go on to the next topic is when to stop. Like, when should you stop exercising? And there's some definite warning signs that maybe you need to see your doctor right away or go to the emergency room to be evaluated. And that is if you're starting to feel abdominal pain especially if you're starting to feel contractions on a regular basis. If you're premature, if you're under the age of 37 weeks, first thing I would do is sit, catch your breath, drink a big tall glass of water, relax, and see if just hydrating will make them pass.
Okay.
But if they're still continuing, you need to go for evaluation for preterm labor.
Gotcha.
So regular contractions prematurely, severe abdominal pain, that would be a warning sign.
Okay.
If you bleed like a period, you should not be bleeding when you exercise, vaginal bleeding. So that needs to be evaluated right away. If you think you broke your bag of water, which is kind of tricky because sometimes when you have a baby sitting on your bladder, you can actually urinate or pee on yourself.
Yeah.
So how do you figure out if you've urinated on yourself? Well, you go to the bathroom and you empty your bladder and put a pad on your panty and walk about and go check on your pad in about 10, 15 minutes. And if there's fluid on that pad, you may have ruptured your membranes and you need to go to the emergency room to be checked. Things like having severe shortness of breath, that you can't catch your breath.
Okay.
All pregnant mommies are short of breath. Like that's very common because the baby's pushing up on the diaphragm, which is the muscle that helps us breathe, and our lung capacity actually shrinks. So pregnant mommies tend to pant or breathe faster because they're trying to keep up with their breath. So shortness of breath in pregnancy is very common, but if you're short of breath and you can't catch your breath, you probably need to be evaluated.
Okay.
Things like severe chest pain that doesn't go away, severe headache, severe calf pain. You know, things of the extreme.
Oh, calf pain.
Yeah, calf pain. If you start having calf pain or
So like calf pain versus a cramp on the calf.
different.
Okay.
Yeah. There are things that can happen in the legs, and I'll mention it, but I don't want anybody to be freaked out about this. But it's you can get deep vein thrombosis or clots in the legs. Pregnancy is what we call a hypercoagulable state, so your blood is more likely to clump and clot.
Oh, wow.
So clots in the leg
Okay.
can manifest in severe pain to the legs and severe swelling.
Okay.
So that would need to be evaluated for that. So yeah, those are the warning signs that the exercise should stop and that you should absolutely go call your provider right away, and he or she may direct you towards the emergency room.
Gotcha. Maria, we're at, the gym's actually closed until 12, just so we're filming. You're good. You're good. We're literally almost done. So I'm glad you said that, because now that I think about it, especially like when I was like, okay, I'm gonna start like getting my workout regimen again during this pregnancy, I started actually feeling some of those symptoms of like the cramping, or like if I'm just like doing just like the right, not even at an incline yet, but just like at a walk, I'm like, oh, like it hurts.
Yeah.
And then what's been tricking me lately is like the discharge, because third trimester discharge is supposed to be increased. And so I'm like, oh my gosh, I'm thinking like, hopefully it's not my water, hopefully it's not anything else. So I'm glad you mentioned those tips.
Yeah.
And
so it's tricky because like the discharge, it's common to have lubricant in the vagina for birth. Like the body doesn't know when the baby's coming. It's just going to start lavaging or having discharge to clean the vaginal passage, right? So having discharge in pregnancy is normal. But when you break your bag of water, that's a whole different thing. Even if it's a small leak, you're just constantly wet all the time. Like it doesn't go away.
Okay.
And so emptying the bladder first, making sure there's no urine in the bladder, and putting a pad and walking about is going to provoke a leak. And that way you can check your pad and go, okay, it is soaking wet. Something is not right. And I just emptied my bladder.
Gotcha.
That way you know that it's not urine, that it may be amniotic fluid, and it needs to be evaluated.
Oh, man. Yeah.
There are other conditions in pregnancy that I didn't mention, but usually the OB has diagnosed those problems before and will say, you know, no sexual activity, no exercise, no heavy lifting more than 10 pounds. They'll give that person precautions when they have complications in their pregnancy where they shouldn't be exercising. So, you know, and I can allude to some of those, but I don't want you to be worried. Like if your placenta is in the improper position, like a placenta previa, if you've had an early abruption, if you have a subchorionic hematoma. I mean, there's all short cervix with a cerclage. There's all these conditions where we don't want mommies having contractions and stressing that cervix and provoking preterm delivery. So usually the OB has already diagnosed those problems and has given you precautions. So those patients usually know.
Gotcha.
Yeah.
Gotcha. So that's why prenatal visits are very important.
Very important. Yep.
Yes. Wow. So those are really great tips because, like I said, especially like the first time moms, like you're just like, oh, okay, I'm cramping because I need more. Like, of course, everyone needs more water, but like you never know what really can be going on. So those are great tips.
Yeah. And talking about earlier, we were talking about diet and hydration. Like as you get more pregnant and the baby continues to grow and the uterus distends, you know, the stomach lives like right underneath this area, the xiphoid process, and in the middle. And so the baby's pushing up and up and up, and everything in the abdominal area gets shifted up. So that's why we get short of breath when we're pregnant. That's why we feel full sooner. So eating your meals and drinking lots of water becomes a little bit of a struggle because you feel full sooner. So I always talked about like being like a little bird. You just have to nibble throughout the day. You know, getting your fiber and your protein and all your carbs and things that you need to get on your healthy diet, but get it throughout the day in little bites so that you're not, you know, having breakfast and lunch and dinner. I mean, it almost becomes impossible when the baby's sitting on your stomach.
Agreed. Yes.
So just little nibbles throughout the day helps. And drinking water, super important. I know a lot of people don't like to drink water, but you can flavor it with like lemonade or something. But getting hydrated is very important. And then patients will say, God, if I'm drinking that much water, I have to go to the bathroom all the time. And that's okay. If you're going to the bathroom all the time, you're staying hydrated and you're less likely to feel the abdominal cramps and the contractions. But it's important to stay hydrated even if you live in the bathroom all day long.
Yes,
So it's important.
And it also helps with the weight.
Yes, absolutely. For sure.
I've been feeling, it's funny because like when you said like everything is pushed up, oh my goodness, I feel literally like from week probably 20 or something like that, I felt her move. Yeah. But now it's getting more like, oh my goodness, it feels like this girl's like, here's my skin. And I know there's a bunch of layers in between, but here's my skin and here's her. And she's just like going at it. Yeah. And sometimes those can be painful. I'm like, oh my goodness. Like what it feels like, I'm very dramatic, but like what it feels like if there's like my skin and there's like guitar strings and like of nerves and like she's like blink.
Yes, exactly. But I'm even watching how we're sitting here today, Angela. I don't know if you realize, but you're leaning back. Yeah. You're giving your baby more room, you know, so that you can breathe and talk with me. And so just the dynamics of how you carry your body, your center of equilibrium gets shifted, which is very important when you're exercising because we don't want patients falling. Yeah. So being aware of the body mechanics of how you're carrying a pregnancy, your center of equilibrium shifting, how your stance, you know, we walk with our feet more open. And, you know, they always call it the pregnancy waddle, but it's, you know, like how we accommodate for the weight that's in the front. Gotcha. And also to give our belly more room and leaning back. So being aware of all these things and the dynamics, if you need an assist to help you, if you're on the treadmill, make sure that you're holding on to the sides. I mean, taking precautions, walk with a friend, sit on if you're on a bike, that's kind of easy, right? Because you're just sitting back or sitting up but doing activity where you're on your feet, be aware of the fall risk and having somebody to hang on to help assist you.
Agreed. So being that we're, you know, in an active environment and like, God forbid, but like, you know, anything could really happen. Say a mom or a patient does fall. What are the immediate signs that we need to look for? What calls to go to the emergency room?
Right. That's a great question. So it depends on the dynamics of the fall. So everybody thinks that just falling in pregnancy means 911 emergency. And it doesn't if there's no abdominal trauma, right? So if you don't fall onto your baby. And a lot of times because we have innate instinct as mommies to catch ourselves. So we'll take the brunt of the fall on the knee or the elbow or the shoulder or wherever. But if you fall and you have no direct abdominal trauma, then just hydrate, monitor. You may be a little sore, take some Tylenol if it's okay with your provider for the aches and pains. But if you have any direct abdominal trauma, or if you're worried at all, just go to an OB/ER where we can put the baby on the monitor if you're appropriate, check your bruises, you know, make sure that everything's okay. But not all falls constitute 911 emergency. It depends on where the fall occurs.
Okay. That's greatly noted because
in terms of obstetrics, right? If you fall and you twist your ankle, then you need to have your ankle evaluated, or God forbid you hit your head. You know, you need to be evaluated for those things. But from a pregnancy standpoint, if there's no direct abdominal trauma and you're feeling your baby move, you haven't broken your bag of water, you're having any bleeding, you're fine.
Okay. Good, because that's always kind of been back in my mind, like, you know, what if something happens?
Yeah.
And, you know, it's like, I don't know those signs, you know, or I don't know, like, okay. But now I know, like, if anything, like, directly, then everything should be fine.
Yeah, and if you're feeling your baby move, baby's fine. I mean, the way I always teach patients in the ER now is the bag of water. I smile because I laugh. This is a Doucetism. I'm coming up with another Doucetism.
I love it.
But the belly, the amniotic bag is like the most sophisticated air bag ever made. It's just happened to be filled with water. And so the baby is very cushioned from things that we, you know, bumping our belly on the counter, or if we do fall, I mean, that baby is pretty safe. It's in a sophisticated water / airbag. You know, there's no air in there. So they are cushioned from things that happen to us. And it takes pretty severe trauma to really hurt the baby in the womb.
Oh, wow.
And so simple falls, very rare. And if there's any worry, they just need to come to a hospital. It has an OB emergency room. We can put the baby on the monitor. We can check the mommy over and make sure everything's fine. But most of the time, those babies are doing fine. If anything, we're treating like worry of the mom or worry of the grandma. The grandma is like, okay, I wanted her checked out. So, and that's fine too. That's what we're there for.
Oh, I love that. That's a great advice right there. So on TikTok, there's videos for everything. There's trends going around. And I'm on pregnancy TikTok.
Okay.
So there's videos of how to like boost labor, induce but not induce labor, prepare the cervix, strengthen the cervix videos. Okay. So I'm sure our viewers have seen this, but it's red raspberry leaf tea.
Okay.
With like a splash of lemonade, eating 6 dates a day, the pineapple, but if anything, like those are the main things, like eating your 6 dates a day and the red raspberry leaf tea. So
the only thing I can think of, like, you know, I would have to research those. I don't know of anything. I'm sure there's a lot of anecdotal things that can help, and there may be some herbal therapies out there that would help. But like if you're eating 6 dates a day and drinking raspberry tea, you're like putting fiber to move the bowels. So you're going to be less constipated. I don't know. Okay. And then you're drinking tea, so you're staying hydrated. I don't know. Yeah. I don't know of any research that's there. You know, and every pregnancy is different and unique. Like common, so it's like wives' tales, right? Yeah. So, you know, what do you believe and what do you don't believe? Well, it's different for everybody. But, you know, things like, well, I ate spicy Thai food and I went into labor, or,
that's true.
You know, it could be different. And what you'll experience this time is that this might be a different instigator of contractions than you had the first time.
That's very true.
So, you know, in all clarity and disclaimer, I would probably have to go do research to figure out like herbal therapies to help in labor. I think if you're exercising and you're staying fit and doing all the right things, you'll go into labor when it's intended.
See, yes, and like you look at these videos and it says like drink like 2 cups a day, starting at 36 weeks pregnant. Usually people start around 32 weeks. Come make my raspberry leaf tea with me. Helps strengthen uterus for labor.
Yeah, no. There's no such thing as strengthening. The uterus is a smooth muscle. And so, like, you can't contract your uterus. Like, it's going to contract related to the hormonal changes in the body. Like, you can't make it contract. That's an internal pituitary gland uterus thing, you know?
Okay.
With a hormone in your body called oxytocin. You can't do that. Now, there is something out there that's important, and that is the pelvic floor, the pelvic diaphragm.
Yes.
So Kegel exercises, strengthening that pelvic floor. And so I'm a big advocate of that. And, contracting the diaphragm is important. But that's also important for after you deliver, not necessarily before. I mean, if you want to keep the pelvic diaphragm tight and strong, there's no harm in that. If you want to learn how to do Kegel exercises, there's no harm in that. But that's really going to be beneficial postpartum.
Gotcha.
And I don't think that matters whether or not you deliver vaginally versus have a C-section, because that diaphragm, that pelvic floor, is carrying the weight and the burden of the pregnancy.
Yeah.
So it's stressed either way. We just know that women who birth vaginally tend to have a little more recovery necessary with Kegel exercises after a vaginal birth versus a C-section. But either way, we need to keep our pelvic floor tight and strong.
Gotcha.
So that is an exercise you can do.
I was about to say, yeah.
But contracting the uterus, really, you don't have control over that, really.
Okay, so to put it all out there, does red raspberry leaf tea induce labor?
I am going to say I've never heard that. I'm going to make a disclaimer that I'm willing to research and get back to you, but I would say no. Off the top of my head, I mean,
You see, but that's why we have a professional here, because we're decoding everything that we see on this internet.
I mean, is there something in raspberry that has a hormone that could start uterine contractions, perhaps? And I'll do some research and get back. But I would say off the top of my head, I've never heard of that. It doesn't mean it's not a thing.
And once again, how many years have you been in practice?
Oh, over 25-ish. So, yeah. I mean, I never tell my patients to drink raspberry lemon tea.
See, there you go. See, that's, like I said, that's why we have you here to decode everything, because I don't know, especially when, I will admit this too, but like, especially like the generation now, like generations, but like in now time, we're looking for the easiest, quickest way to go through anything. And like I said, I will admit to that as well. So, but it's so great to hear from you, what's a yes, what's a no. But also like you're giving like, your disclaimer, like, let me do research about it, which alludes to the whole, like, everyone needs to do their research.
Don't believe everything that's on social media. There's a lot of videos, I guess, on TikTok and Instagram and all that. And I'm going to be honest, I haven't looked at them, so I don't know what's out there. But my best advice would be, if you're following somebody on Instagram or TikTok or Facebook or something, and they are teaching these exercises or healthy diet, take it back to your provider and say, hey, I learned this. What is your opinion? Because everybody's unique and different. And if somebody's in really good physical condition and your provider looks at that video and goes, hey, these are really good exercises, maybe it fits for that particular patient. But maybe for somebody who's had, let's say, back surgery and is pregnant, and maybe that person shouldn't be doing those kind of exercises with rods in her back. I mean, everybody is unique and different. So I think the best advice is, if you're following somebody and you want to do those exercises or those special diets or raspberry lemon tea, then take it back to your provider and let them do the research and find out. And I will get back to you.
Nice. My first pregnancy, there was this thing called witch's brew or something like that. Something brew. And now, like, looking back at it, I'm like, oh my God, why did I try that? But it was disgusting.
Oh, what was in it? Witch's brew?
I don't know. Let me make sure I got the name right.
Well, I mean, like, there's, for example, I have a friend, and she did midwifery for many, many years. And she taught me maneuvers on how to get a baby to turn from breech to cephalic. I mean, and I learned that from a midwife. So I believe that there's other modalities out there. I'm a conventional American trained doctor. I learned our way. And so it doesn't mean that there aren't other ways. And whatever works for people is what they should do, as long as it's under the guidance of their healthcare provider. I mean, I think that's the right answer.
I like that. And disclaimer, I don't think it was called witch's brew. I don't know what it was called, but I don't know why that name came to me like that. No, I tried some kind of brew that, we went to the store, we picked out the ingredients, and we mixed it all together, and I was like, this is disgusting, but it was supposed to induce labor. And I don't think it obviously didn't work, because she went to 41 weeks.
So you want to really know? I don't know if you want to post this, but I'll tell you. You can record it. having intercourse, and you have to say the word sex because some people don't know what intercourse, but having intercourse after 37 weeks deposits prostaglandin in the vagina. So the ejaculate from the man has prostaglandins. And what do we do to induce and ripen a cervix? We put prostaglandin in there. So prostaglandins will soften a cervix and can cause uterine contractions. So that's why you always hear OBs saying, well, you're 37 weeks, you're tired, you can have intercourse.
Yeah.
You know, start having intercourse because that will that's the problem. They're like, I don't feel like it. My belly's out to here. My baby's kicking me. Yeah.
No, but no, yes.
And so that is true.
Yeah.
And so that's why many times, especially in the OB/ED, we have women coming in after 37 weeks and they're contracting because they've recently had intercourse with their partner. And sometimes it'll kick them into labor and sometimes it doesn't.
Oh, wow.
Yeah.
So, okay. So say like that happens and then it cramps. Can those cramps last as long as like 1-2 weeks until it's like it's time to go into labor?
Yeah, so that's opening the whole discussion of what is labor and what's not labor. But because women can experience what we call false labor or not real, like you can have a lot of contractions and then there's a pattern and they're coming every 4 minutes and they're getting stronger and oh my gosh, I feel all this pressure and it's getting, you know, like harder. And then after 2 hours, 3 hours, 4 hours, they just peter out. And so we monitor. If there's no cervix change, we send you home. So that's an episode of false labor. But once a woman really gets into the active phase of labor, it doesn't stop until there's a production of a little one.
Yeah.
So, yeah, I mean, that's the difference between false and real labor is false labor goes away.
Gotcha.
It was false alarm. Right?
Gotcha, yeah.
So hydrate, monitor, time, call your provider, get your cervix checked, things like that. And if it goes away or peters out, then that was just an episode of false labor. And as you get further along in the pregnancy, 37, 38, 39 weeks, you may have bouts of false labor. And how do we know? Well, we check the cervix, see if there's cervical change. We monitor the contraction pattern. We monitor the baby. And then we as providers know what's real and what's not.
Yeah. Gotcha. Nice. All right, everyone. So for this last segment, I'm super excited because we're actually testing out my workout regimen. And we have Dr. Doucet here once again. And she's going to actually be critiquing, giving advice, what I can do, what I should avoid. So so let's do it. So I always start off on a treadmill just for a little like cardio workout. So like I said before, I did a 2.5 of walking speed. 10 minutes of just kind of getting my body at a 0 level. And then after the 10 minutes, I'll bump it up to an incline of 6.
Yeah. I think that's really pretty good. I mean, I'm impressed that you get an incline of 6. So
Thank you.
That's excellent.
Thank you. I'm real happy about myself, real happy about that, just because like also before I was pregnant, I usually would do like either at an 8 to kind of warm up and then a 12 to really get a workout
that's
in.
awesome.
So I felt like 6 was like just like the great level to do it.
For sure.
So, okay. I don't know how much we can take on just walking,
but well, I think my best advice would be once it gets started, you know, talking about the center of equilibrium and your balance being off kilter, just to be holding on for safety. Even if pregnant moms are used to jogging and jogging on a treadmill, I would encourage them always to just be holding on for balance.
Gotcha. One thing I have noticed, like whenever I do work my body just a little too hard, that I feel like I really need to like hold on because I feel like a little dizzy sometimes. And that's when I bring it down a bit. But so I feel like this was a great way to really get my heart rate.
Yeah, your heart rate
going. And this is actually a good test. The talking test.
Yeah, the talking test. So there's actually graphs and grids on your age and where your heart rate should be when you're pregnant and exercising. So that's something that the providers can look up for you. But holding on, I mean, this is really cool because you can actually monitor your heartbeat if you wanted with a treadmill or any of these devices that you see at a gym. Usually you can grab on and check your heartbeat to make sure you're not exceeding what your provider has told you your limit is.
That's right. Okay.
Yeah, it's excellent.
Cool.
Yeah, you're doing good.
All right, next. All right. Well, next thing after I do my treadmill, I find a little space, get some dumbbells.
Yeah, that's good.
I'm not usually an arms person, more like legs and cardio. But one thing throughout this pregnancy, I did want to make sure that I toned something.
Yeah.
I kept something toned.
Mm-hmm.
And also with the fact of like, I don't know how much my little girl is going to weigh, and I have 2 babies. So it's like, I need to get these arms toned either way.
Yeah, yeah.
Okay. So what I usually do, I just start warming up. I'll do I'll do 3 sets of 10 of these. Don't come for me because I don't know the proper name of these.
Those are barbell. Those are curls, right?
Curls. Okay. Thank you. And then I kind of like try and do like an all around workout with
For
my
upper
arms.
body.
Yeah. I'll do these. Now, what are these called?
Overhead press.
Okay.
Right?
Thank you.
That's good.
And then I'll do shoulders.
Yeah, lateral raises.
Yes.
That's good.
And like I know like some workouts like they do both. But like for me, just because how I'm feeling,
one at a time.
One
That's
at
good.
a time. Yeah. Usually I just do 3 rounds of 10 for those. And I usually either a 3-pounder or a 5-pounder. And then I would go into my squats to start focusing on the legs.
Do you do your barbell, the dumbbells with your squats?
Yes.
That's good.
Yes. So I'll go into these.
Oh, wow. That's pretty good.
And to focus like on my legs.
Yep.
But also I feel like because squatting to kind of get my
open the pelvis a little bit.
I can't talk. Yes.
Open the pelvis. Yeah.
Yes.
I think
so
that's good.
Squats are a main kind of main thing that we want to focus on as third trimester.
Yep.
Okay. Awesome. So so I'll just do that.
Yeah, I think the only thing would be being careful not to go too deep. Maybe just go to like you're going to be sitting on a chair, like stop. Yeah, because once you overextend, you can actually hurt your knee, especially when you're carrying more weight.
Gotcha.
So like you go like you're going to sit on a chair. Yeah.
Okay. Cool.
Yeah.
Yeah.
Yeah, and if you're doing like your curls while you're squatting, you're getting like 2 things done at one time.
Oh.
Yeah.
Oh.
I heard some snap crackle.
Yeah, those are my knees.
Yeah, and then so the only other thing I would say is like if people don't know how far to go, then you could bring a bench or a chair and just go down to the chair and then go back up, and go down to the chair and go back up. And that way you're not overextending.
Agreed.
Being safe. And also if you're putting a chair behind you, if you're losing your balance, you can sit back and be safe from falling.
Yes, I like that.
Yeah. Good.
And then usually next I would get like
okay, you're for core kettlebell. Are you gonna swing it?
Huh? No. I do I try to do like RDLs. One thing I do see a potential, not necessary problem, but like a potential block is the belly getting bigger. Yeah. Because right now I just got reminded of like how hard it kind of is.
Yeah, to bend over.
Yeah. So those might be ending pretty soon. But yeah, so arms and then the squats. And then whenever I do the incline on the treadmill, that's where I also get the workout for my legs.
The only thing that I would say in terms of exercises is making sure that you're stretching.
Yes,
so I know that yoga is very good in pregnancy in terms of stretching and being limber, but especially like opening the pelvic floor and doing stretches to keep the pelvis open for birth. And a lot of times when we're delivering babies, sometimes we'll hyperflex the hips. Woo, let's see how good my core is. So hyperflexing the hip.
Let me get the ball real quick.
And I'm maybe not on this, but something stable to.
Oh, okay.
I'm just doing that because I'm sitting here.
Gotcha. Oh.
But extending the legs open and out. Maybe getting down on the floor and opening the legs. Just opening the pelvis.
Okay.
See, look how good. That must be your dancing from before.
Yes.
But opening the pelvis and hyperextending the knees, because the baby is here when you birth, you're in a position where your legs are up. And so a lot of women aren't stretching and staying limber. And so when we get them into that position, they're like, oh, my legs hurt. My legs are hurting because they're not staying limber and stretched to get in that position.
Yeah.
Yeah.
Okay.
And then one other thing that is important, a lot of people know this, but stretching the calves, I don't know if you get those calf cramps in the middle of the night.
Yes.
So bad.
Yes.
So you can lean on, I can show you on the ground, but you can lean on something and just stretch your calves, like stretching your calves, especially when you get those cramps at night. The sooner that you break the cramp, the less lactic acid buildup and the less soreness. Yep. And so you want to bend the front knee and kind of stretch the back. Mm-hmm. Or you can get downward dog.
Yeah.
Doesn't that feel good?
That feels real good.
Yeah. Downward dog is like a yoga pose where people can stretch their arms and stretch their calves, sort of like this position where you're stretching your calves and you're stretching your shoulders.
Oh.
Yeah. Feels good, doesn't it?
Oh, yeah.
But that's really good because the baby is going down to the ground and you're taking the pressure off your back, stretching your back and stretching your legs.
Okay.
So simple things like that.
Nice.
Yeah. Are you short of breath? 911?
Sit down for a second. Those are great. Yeah. Those are really great.
So that's good. I think that's a good routine.
Thank you.
Yeah, but I think that people should do whatever they're doing.
Yeah.
And then maybe incorporate some flexibility and stretching and absolutely check with your provider, make sure it's all good and that you're safe to be doing those things. But I think exercise in general is just going to make you feel happier and healthier in your pregnancy.
Yes, I agree. I really do feel much difference compared to my first pregnancy.
That's good.
So like third trimesters as we're preparing for labor. Mm-hmm. So stretching is one of them.
Yeah, I think stretching is good, especially if you're going to have vaginal delivery. Mm-hmm. And then if you're an exerciser, or if you've incorporated exercise in your pregnancy, your recovery is going to be much faster and better.
Gotcha. Yeah. Is there any like exercises that we can do to get the baby ready, like to get the baby, or is that like another kind of myth?
Yeah,
like,
that's probably a discussion for like if the baby's in the breech and how do you get them into the cephalic, or if the baby's in the sitting and how to get the baby into the head down. Yeah, we can talk about that another time.
Gotcha.
I don't want to give people advice and maybe their provider doesn't believe in that. They did, that's a wives' tale. It never would work. But, I did learn some tricks from my midwife friend. And so I believe in it, but that's my style and everybody has a different style. So I don't want to make any of the doctors out there upset or any of the nurse practitioners. So I would just check with your provider and make sure that it's okay.
Okay. Yeah. Nice. Cause I know, like the downward dog and like just kind of like on the ball, like just like moving and then bouncing kind of gets like the baby, I don't want to say like in position, but like maybe like lower.
Like
low.
So when a woman goes into spontaneous natural labor or even induced labor, there's one of the cardinal movements is engage in the pelvis. One of them is engagement, where the baby drops into the pelvis. Mm-hmm. And most women know when that happens. They'll say, "Oh gosh, this baby dropped on Saturday. Like, I can breathe so much better. The baby's dropped." So the engagement is, one of the beginnings. I'm not sure if bouncing on a ball or doing exercises will really help that because it requires contractions to get that baby to drop.
Gotcha.
And so, but I mean, if it works for you, why not? We do have birthing balls in the labor units. And so there are many women that will bounce on their ball and they feel comfortable. It makes them feel like they're staying active and participating in the labor. And that's fine too.
Okay. Nice. Question.
Yeah.
Is the hospital that I'm laboring at, do they have the medicine balls? Okay.
They have medicine balls.
I was just wondering if I need to bring it or.
Yeah, here in Corpus, like I don't know down in the valley in our other service areas what they have, but here at the 2 hospitals in Corpus where we deliver, they have birthing balls and they have peanut balls. I don't know if you've ever heard of a peanut ball. It looks like a big peanut and they come in different sizes. And the nurses are super instrumental in getting women in different positions to help the baby rotate through the pelvis.
Gotcha.
So there are tools like that to help you birth. Yeah.
I'm ready.
Yeah.
I'm ready to go. No.
But not yet.
No, not yet. No. I'm mentally ready. I am mentally ready and I don't feel as scared and as like unsure of how everything could go and whatnot. I am now well educated on C-sections, what can go with there because my last one, and then like VBAC and how I can help So thank you,
Yeah,
Dr.
for sure.
Doucet.
Well, hopefully we're helping a lot of patients and mommies to be out there with all this information so they won't be so scared going into that experience.
No, for sure.
Yeah.
So if you all have any questions for Dr. Doucet, whether that's with pregnancy, workout, maternal health, literally anything of that realm, leave that in the comments below. And then maybe we can go like on an Instagram, Facebook Live and just address those questions and we can get those answered for y'all.
Sounds great.
Awesome. Well, thanks everyone for watching and we'll see y'all again. Bye.